Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Lactose intolerance. Introduction. Lactose intolerance is when the body is unable to digest the sugar lactose found in dairy products. The condition is also known as lactase deficiency. Lactose intolerance is usually not serious. It is estimated that 70 to 75% of the world's population has various degrees of lactose intolerance. This program will help you understand lactose intolerance. It discusses the causes, symptoms, and treatment options. A special section lists food with lactose. Lactose intolerance. Lactose is a type of sugar found in milk and other dairy products. People with lactose intolerance are not able to fully digest lactose. An enzyme called lactase is created in the small intestine. An enzyme is a compound that breaks down other substances or speeds up chemical reactions in the body. Lactase breaks down lactose so that the body can absorb it. Lactose intolerance happens when the body doesn't make enough lactase. If the body does not have enough of the enzyme lactase, lactose moves on into the colon without being broken down and absorbed. Normal intestinal bacteria in the colon interact with the lactose. This causes gas, diarrhea, and the other symptoms of lactose intolerance. Lactose intolerance may develop later in life. It is not common in young children. This is because the amount of the enzyme lactase created by the small intestines can decrease over time. Lactose intolerance does not mean that you cannot have milk or dairy products. Most people with lactose intolerance can tolerate some lactose in their diets. The symptoms of lactase deficiency differ from person to person. Some may have severe symptoms, while others may have no symptoms. Types. There are 3 types of lactose intolerance: primary, secondary, and congenital. Primary lactose intolerance is caused by aging. Lots of lactase is produced during early childhood because milk is the main source of nutrition. A decrease in the amount of lactase is common as we age and our diets change. Secondary lactose intolerance is caused by an illness, surgery, or injury to the small intestine. These may cause the small intestine to decrease the creation of lactase. Congenital lactose intolerance is rare. It is when babies are born without the ability to make lactase. They cannot tolerate their mother's milk and have diarrhea from the time they are born. Instead, they must have lactose-free formula. Risk factors. There are a few known risk factors that make you more likely to develop lactose intolerance. One risk factor is age. Lactose intolerance is uncommon in young children. It becomes more common as you get older. A person's ethnicity may also increase his or her risk of developing lactose intolerance. Caucasians are less likely than other ethnicities to develop lactose intolerance. Babies born prematurely are more likely to have lactose intolerance. The enzyme lactase increases late in a baby's development in the womb. Premature babies may be born before this happens. Having celiac disease, Crohn's disease, or other diseases that affect the small intestine also raises a person's risk for lactose intolerance. These diseases can harm the small intestine where lactase is made. Also, lactose intolerance can develop after having radiation treatment to the abdomen. Radiation is often used to treat cancer. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Symptoms of lactose intolerance are mostly mild, but they may become worse if a large amount of food with lactose has been eaten. Common symptoms of lactose intolerance include gas or bloating, abdominal cramps, nausea, Diarrhea. These symptoms usually happen anywhere from 30 minutes to 2 hours after drinking milk or eating milk products if they are caused by lactose intolerance. You should check with your healthcare provider if you have the symptoms of lactose intolerance. These symptoms may also be caused by other illnesses. Diagnosis. If you have the symptoms of lactose intolerance, your healthcare provider will try to find out if you have lactose intolerance or if something else is causing your symptoms. Your healthcare provider may begin by asking you to eat less food containing the sugar lactose. This means eating less dairy products. They may also ask you to avoid these foods for a short time. If your symptoms improve, there are 3 tests that can confirm the diagnosis. For the lactose intolerance test, you will be asked to drink a liquid that has a lot of lactose in it. Your blood will be taken 2 hours after drinking the liquid to measure glucose, another sugar in the body. If your body is not properly digesting lactose, your glucose level will not rise. This is because the enzyme lactase breaks down lactose into glucose and galactose. These are simple sugars that are then absorbed by the body. Another test used to diagnose lactose intolerance is the hydrogen breath test. You will be asked to drink a liquid that has a lot of lactose in it for this test. At different times, your healthcare provider will measure the amount of hydrogen in your breath. Hydrogen levels in the breath are normally very low. If you have lactose intolerance, hydrogen levels in your breath rise after ingesting lactose because the undigested lactose moves to the colon where it is acted on by bacteria, causing the release of hydrogen that then makes it into the breath. The stool acidity test is usually used to diagnose lactose intolerance in young children. The large amounts of lactose needed for the other tests may be dangerous for them. This test measures lactic acid and other acids that are released if lactose reaches the colon without being digested properly. Treatment. The main treatment of lactose intolerance is to manage the symptoms by changing the diet. Most people with lactose intolerance do not have to give up milk or milk products. You may be able to tolerate milk and milk products if you drink small amounts of milk at a time. 4 ounces is recommended. Some people find that milk or milk products are better tolerated if taken with a meal. Others can also start with smaller amounts of milk products and gradually increase the amount. You can also eat milk products that are easier for people with lactose intolerance to digest, such as yogurt and hard cheeses like cheddar and Swiss. Other options include drinking lactose-free milk and milk products and soy or rice milk. Also, cheeses and yogurt have less lactose than milk and may be easier to digest. Milk and milk products are the best sources of calcium. You may need to look for other sources of calcium to replace what you are losing as you change to a low-lactose diet. You can also take lactase enzymes before you drink or eat milk products. This may help with digestion and ease your symptoms. They can be added to regular milk or taken as a pill. Food with lactose. Lactose is found in milk and all foods made with milk, such as ice cream, cream, butter. Other foods that contain lactose include cheese, cottage cheese, yogurt. Rarely, people with lactose intolerance are bothered by small amounts of lactose. Some boxed, canned, frozen, packaged, and prepared foods contain small amounts of lactose. These foods include bread and other baked goods, waffles, pancakes, biscuits, cookies, and mixes to make them. Prepared or frozen breakfast foods such as donuts, frozen waffles and pancakes, toaster pastries, and sweet rolls. Other foods that contain small amounts of lactose include boxed breakfast cereals, instant potatoes, soups, and breakfast drinks, potato chips, corn chips, and other packaged snacks, prepared meats such as bacon, sausage, hot dogs, and lunch meats, margarine. Other foods that contain small amounts of lactose include salad dressings, liquid and powdered milk-based meal replacements, protein powders and bars. Other foods that contain small amounts of lactose include candies, non-dairy liquid and powdered coffee creamers, non-dairy whipped toppings. Look for certain words on food labels. These words mean the food has lactose in it. Milk, lactose, whey. Other words that indicate lactose include curds, milk byproducts, dry milk solids, non-fat dry milk powder. Calcium and vitamin D. Milk and milk products are the most common sources of calcium. Calcium is a mineral the body needs for strong bones and teeth. If you are lactose intolerant, make sure you get enough calcium each day. Other foods contain calcium, such as canned salmon or sardines with bones, broccoli and other leafy green vegetables, oranges. The following foods also contain calcium: almonds, Brazil nuts, and dried beans, soy milk and tofu, products with added calcium such as orange juice. To absorb calcium, your body needs vitamin D. Be sure to eat foods that contain vitamin D, such as eggs, liver, and certain kinds of fish like salmon and tuna. Sunlight also helps your body make vitamin D. Vitamin D is added to some milk and milk products. If you're able to drink small amounts of milk or eat yogurt, choose varieties that have vitamin D added. It's hard to get enough calcium and vitamin D even if you eat and drink milk and milk products. Talk with your healthcare provider about how to get calcium and vitamin D in your diet. Ask if you should also take supplements to get enough calcium, vitamin D, or other nutrients. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Lactose intolerance means that you cannot digest foods with lactose in them. Lactose is the sugar found in milk and foods made with milk. After eating foods with lactose in them, you may feel sick to your stomach. You may also have gas, diarrhea, swelling in your stomach. Your healthcare provider may do a blood, breath, or stool test to find out if your problems are due to lactose intolerance. Lactose intolerance is not serious. Many people with lactose intolerance can tolerate small amounts of milk, 4 ounces or less, at a time, especially with meals. Over-the-counter products are available and may help you digest milk and milk products. Milk and foods made with milk are the most common source of calcium for most people. You may need to take a calcium supplement if you don't get enough of it from your low lactose diet. Thank you for using Explain.